Hello everyone, this is Dr. Humanist again. Let us now discuss about hyperbaric oxygen therapy. Right. So basically, what we are doing here is we are giving oxygen at high pressures. Right. Pressures usually more than 2 to 3 times the atmospheric pressure. Mechanism of action: it increases the oxygen delivery to the tissues. Right. It prevents the hypoxia. Promotes the healing by various mechanisms. It inhibits the bacterial growth, especially the anaerobes. Right. So high oxygen environment will be toxic for them. It reduces the edema by vasoconstriction. It stimulates the neovascularization and it enhances the immune response also. Okay, so we'll see what are the indications of hyperbaric oxygen therapy. Decompression sickness, as we all know, it in that there are big nitrogen bubbles formation. So this hyperbaric oxygen, what it will do, it will create a gradient such that the nitrogen from the bubbles will go and diffuse back into the blood and reducing the size of the bubbles. Same thing it happens in gas embolism also we can use. Okay. Next is carbon monoxide poisoning, right? As we all know, carbon monoxide has higher affinity towards the hemoglobin, 200 to 300 times. So it displaces the carbon monoxide from the hemoglobin. Right. Next is necrotizing soft tissue infections. As I said, it inhibits the bacterial growth, it reduces the edema also, and it stimulates the neovascularization. So we can use in these cases. Next is chronic non-healing wounds, similar mechanisms like diabetic foot ulcers we can use. Radiation injury induced tissue injury, right? Crush injuries, compartment syndrome we can use. Osteomyelitis, that is refractory to the antibiotic treatment. Severe anemia, as it temporarily improves the oxygen delivery. Thermal burns, and also in the sudden sensorineural hearing loss. Okay. So coming to the procedure, there are two types of chamber, either monoplace, that single patient chamber, or multiplace, that multiple patient can use that chamber same time. Okay, so this is the multiplace chamber and this is single chamber, right? Monoplace. Treatment protocol: sessions will last for 1 to 2 hours. Daily we can do or several times a week we can do. Okay, patient experience, there will be patient will relax and it can use television also. Okay. Next is, what are the side effects? Okay, ear barotrauma can be there, right? Because of pressure changes, right? Suddenly pressure will change and that will cause ear barotrauma. Sinus pain can be there. Oxygen toxicity, right? Because we are providing oxygen under high pressure, so it can lead to neurological symptoms of oxygen toxicity. Pneumothorax it can cause, right? And this is one of the absolute contraindication. Temporary vision changes can be there because of myopia. Fire hazard, as we are using oxygen in this. Contraindication, as I said, absolute contraindication is untreated pneumothorax. Other than that, COPD, because it has a risk of hypercapnia and then can lead to pneumothorax itself. Claustrophobia, okay, we can use angiolitis for the patients. Recent ear or sinus surgeries. Okay. So what are the emerging uses of hyperbaric oxygen? Traumatic brain injury we can use, stroke recovery, and cancer treatment. Still the research has been going on. So this was a short discussion on hyperbaric oxygen therapy. Thank you.